Welcome, Shelby. Thank you for taking the time to be here today to talk about your birth. And for context, for people just joining us, you are a mom of two. Your youngest is 4 months old. You're joining us from Salem, Massachusetts, and you had a VBAC, so a vaginal birth after cesarean, after your first baby. And you also happen to be a nurse in the pediatric ICU. So you are like a healthcare provider yourself. So there's so much to dive into. I just loved reading all that. And I just had to interview you. So thank you for being willing to share your story.
Oh, yes. Thank you. I'm happy to be here. I think it's been quite a journey. And I think once you've gone through all of this, you get brave enough to share your story. My huge takeaway is just is advocating for yourself and how to do that. As a nurse, I'm an excellent advocate for my patients. And that comes by supernaturally. But when you're the one advocating for yourself, it's like a completely different story. And I really struggled with that. And really, the second time around, wanted to make sure I was more confident in my advocating skills for myself.
And it sounds like you were, but there were some moments in your birth. You mentioned that, you were like, I don't want to be on my back. And you were unmedicated. And it sounded like it went pretty fast. And you also made the comment when I was reading it that you were kept being treated like a first timer. I thought
Yeah.
that was interesting that you wrote that.
Yeah. I actually, so when I felt very in touch with my body most of for both of my pregnancies, actually. And I actually went into labor with my first, even though I had a cesarean. Molly was breached. And so I went into labor the night before my scheduled C-section, which is wild. So I kind of already knew what to kind of expect in some ways. And so when I was calling on my way to the hospital for my son, the care provider wasn't my OB. It wasn't on call that day. And so when I spoke with them, they were kind of just like, oh, yeah, like, sounds like you still have some time and like, don't worry about it. In the meantime, like, I had gone into labor overnight, but was just kind of like able to sleep through it still. And so I was trying to rest as much as possible and just take my time. And we had to like drop off my 2-year-old. So I was like doing all these things. But eventually I told my husband, I was like, okay, now like we need to get going. Like things have
Mhm.
changed, right?
Mhm.
But then the minute that doctor said that, I started doubting myself. And I was like, oh my God, are we going in too early? Like, I don't know. I don't want to get stuck in the hospital forever. Like, that's why I waited for so long in the first place. And my husband was just like, Shelby, like, we're already on our way. It's going to be fine. Like, here we are. And so when we got there, I mean, long story short, I checked into the hospital at 10:20 and my son was born at 12:20. So like 2 hours
Mhm.
passed and my son was out from the time
Amazing.
that I got to the hospital. So I think that the provider was a little wrong. And it's so because when I actually started going into active labor, it was a wild show. It was the weekend. The OB that was supposed to be like on call was in the OR still because they were just, like scheduled C-sections are still happening. And so this older OB came in. My husband says my water broke all over her. Like it was just
Amazing.
it was a scene. And so fast. And I think that piece also made it even harder to advocate for myself because
Mhm.
that physician had planted a seed of doubt in my head. And I stopped listening to myself and started listening to them once I got to the hospital. And so when I actually started going into labor, I was caught off guard. I was like, what? It's already happening? Like I wasn't ready. I like had all these grand plans, but we had just gotten to the room and basically I went straight into active labor and just didn't look back. Um, but the biggest piece is when I finally got into labor and the nurse was like coaching me, telling me to like do purple pushing, right? And I'm just like in the throes of it. And so I do what she's telling me to, right? And I'm just sitting there and no one's talking to me really, except for the nurse every now and then. And she kept like rubbing my stomach in between contractions. And I just kept being like, please stop touching me. I just like didn't want anybody to touch me.
Oh my God. Yeah.
And my husband's like, I thought you were going to snap her head off. Um, But I,
Did she eventually stop?
no, she kept doing it. No, she kept doing it.
Oh, really?
Um, and I'm not really sure what that was all about. Again, I don't I feel like, again, when you go in as a VBAC, I think there is some hesitancy in that there is risk. And so they do all these extra things for you that you don't get told. Or maybe I was going to get told eventually, but no one had the time to tell me because it all just happened so fast. Because I
Can you
also
give me
found
an
out that
example, Shelby? Like, what did they do for you?
so the rubbing up my belly, I feel like that might have been some sort of protocol for them when like they were trying to help the baby get out if he was stuck in there. Again, they weren't really talking to me very much. And so I kept asking, like, what's going on? Like, where am I at? Where is he? What's happening? You know, like I feel a lot of pain because I don't have it. I'm feeling everything. Um, but they're not communicating. The one thing that they did communicate, how funny enough, was they wanted to put lidocaine around my vagina to kind of help some sort of like numbing pain thing. And they were like, kept asking me this question right in the middle of a contraction. And I cannot answer these questions for you people.
No.
Like timing. It's so interesting. And I think as a care provider, we we've done it so many times in some ways that we forget like some of the normalcy of things. And we I see that especially with like surgeons, which I've kind of like put OBs in this category of
They are
surgeons.
surgeons. They are surgeons.
Which before having children, I never thought of them like that. I thought of them as like these sweet like care providers that love babies and love women's health, and you know they're going to spend all this time with me and they're going to educate me and they're going to be these like lovely little like made up fairies in my head, and that is just not the case. They're very much a get in get out, and I can't speak for every care provider by any means, but my practice, I most of them were that way. And so I lost my train of thought there for a second, but it was very much just a get in, get out, and there was no. And that's how I found you. That's how I found like a lot of people, because you think that your OB is going to be these magical people that teach you and give you everything that you need to have after you have a baby or during when you're having the baby, when you're pregnant, but they don't give you that. It's very much a get in, get out. But back to my surgeon comment, I think surgeons in general just get wrapped up in their practice and their art of surgery, and they do it all the time, and they kind of have it. They have a 100% have a different perspective on how things are supposed to go and how things go, and I don't find them to be excellent communicators by any means. And that I speak to in my practice as a nurse. I work with surgeons often. I'm in the ICU, so I don't work with them directly in the OR, but they still round on their patients post-operatively, and you've got your micromanagers, and then you've got your ones that are hands off that do the surgery, and then you never see them again, and you're like, wait, there's other things happening.
Mm.
But all of them, I shouldn't say all of them, I should say a lot of them just have a different perspective on like the care piece. And as a nurse in the ICU, we do a lot more thinking about the whole picture as well. And I think surgeons and OBs and things like that are very focused on like the procedure itself, and then kind of lose focus outside of that.
Yeah. It's interesting you say that. I was at a friend's appointment recently. She asked me to come with her to speak to her OB. So, and she's single. So I went with her and I was like her advocate slash partner. And I like this OB. She actually did surgery on me like 6 years ago for a polyp removal before I had kids. But she kept saying, well, you want take home baby. That's what I'm here for. Take home baby. And it was very much around like, and it's amazing. You need like someone who's going to watch out that you can take home a healthy, living, breathing baby. But there was no time for, well, I'm not here to like fluff your feathers. Like, we're just here to take home baby. That's my job. It's not like, and I'm going to hold your hand and help you have a good experience. Like, it's like,
Yeah.
no, right. And in fairness, they're busy. There's a line out their door. They've got a lot of pressure on them medically, legally, whatever. they can't be all those things. But it's important that people recognize that if they want those things, they're going to need other people on board for them, right?
Yeah. And I think that was a learning process for me too. I had like this kind of like grieving time after like after my first few appointments after my first baby, where I realized that that's not what my OB was. My OB wasn't going to be the catch-all for everything that I wanted her to be, that I expected her to be. And I don't know if we get this idea that the doctors are going to be everything and do everything from television, or like where I got this idea in my head that like the OBs were gonna do everything and have all of the answers. But I did. I had that expectation, and that was not my that's not reality. Yeah, and I think a part of you kind of grieves that, and then are left being like, now what? Like, I still need X, Y, and Z answers, and where do I find those? And I don't not all OBs are going to help you find that either. When I had my first, I had a lot of tailbone pain afterwards, and they just kind of brushed me off. And the nurse on the call that I had just told me I probably broke my tailbone and I should just rest and and it'll go away. That was not the case. That was not the case at all. And hence my deep dive into pelvic floor and what that is and how to take care of that. And again, how I found you and educated myself in that way. And I am currently in the process of trying to be a resource for moms too, with my background now, and having gone through birth twice. I see that there's still a need, and like I'm a very educated, resourceful person, and I still was left in this place at one point in time where I didn't know what to do. Like I knew I had a problem and I didn't know where to reach out to, and I don't want other moms to feel that way too. I tell anybody who I have the chance to like reach out to you,
No.
to like prep yourself, and or like after a C-section, like reach out to these, like now that I have found resources, I want other people to have those resources and not be in that dark place that I was.
Really.
And have a successful VBAC if they can, because it can happen.
Yeah. And that is something that is, I know there's going to be people because they'll see, the different, like the topics that we cover. So I'm sure that a lot of people will watch this who are planning for, hoping for a VBAC themselves. So what would you say to anyone watching this who is themselves hoping for that?
One, that a VBAC isn't for everyone. Like, you have to know that you have to listen to your body. And if the VBAC isn't for you, if a scheduled C-section is going to be a better, safer option for you, whether it be physically or for your mental health, then that's okay. Like 100% okay. And then for those of you that really want to try and everything is like in place physically and that's a thing, then look for those resources and build your confidence. Surround yourself with people that also believe in you, and believe in your goals, so that you can have a successful VBAC. I think truly like giving myself the confidence and like having the tools I took your push prep course my second time around too, because I was like, this is happening. Gotta have the tools, right? And so I did, and I think it was because of your course that in those moments when I was being coached to purple push and was doing it in the midst of the moment, that I heard the voice in my head be like, no, Shelby, engage your core. You got that. And I did. And when I engaged my core, like, I can't exactly remember these days anymore, but like 2 or 3 pushes later, like my son was out. Like I pushed for a total of 20 minutes. Who knows? Maybe if I had listened to that voice in my head from the get-go, it would have been shorter. I don't know. But like you can do it. And I'm like, we're all here to support you. So find those resources and listen to your body. You know your body better than anybody else.
I love that you mentioned too, you were told, and I think you used all caps, like repeatedly told to get on your back. And you were like,
Ugh,
no.
I
So,
was. It happened because my so when they first checked me, I was only 5 centimeters. So they're like, oh yeah, you got more time. And then I had this really big contraction after I used the bathroom when we got into the labor room. And there was like some blood on the floor. And I like freaked out, of course, too, because that was unexpected. And my nurse was like, no, no, no. Sometimes when your cervix changes really quickly, you can have some bleeding. So she's like, so on the lines of that, we should probably check you again. And I was like, okay. So of course, when they want to check you, they want you to be in the placement that they
mm,
like, which is on your back. And so I'm like trying to like be on my back ish. But then the minute they were done checking me, they were like, oh, you're only 9 centimeters. And I was like, no, like this baby is coming. Okay, guys. So then they wanted to break my water. And so in between that time, I had kind of like turned onto my side because that was way more comfortable
yeah.
than being on my back. Um, and they like had a discussion about whether or not they're gonna like how they're gonna break my water or whatever. But then my water ended up breaking, like I mentioned earlier, all over the physician, like as they were about to break my waters. So they ended up not having to do that. And then yeah, out came the baby. And at that point, like I wasn't moving.
Hmm.
I had all of these kind of ideas about different positions that I wanted to do. And when I had been laboring, I had been trying a bunch of different positions. But then once I did get stuck kind of in the bed at that point, all I kept thinking was, I will not end up on my back. I will not end up on my back. And so I chose my side because that was the kind of the easiest
Hmm.
non-back position to get in at that point. And I didn't mind that. It worked. It worked. Again, I listened to my body. And at that point, I like knew that I was not in a place where I could actually like move further off of the bed, but I knew that I didn't want to be on my back. And so that seemed like the best option to me. And I think it was.
Absolutely.
So I got the baby. My son was born. So I
That's amazing.
pushed him out. Yeah.
I love what you just said too, because you were like, I wasn't moving. And like I get shivers because I know exactly what that feels like, especially when I feel like with your second, like you're sort of like, I did it your way the first time, and now we're doing it my way. And like you're more, because I remember with, at least for my own, my first, it was very much like, I don't want to be on my back. You have to. And you sort of like oblige, also unmedicated, excruciatingly painful to it for anyone who knows, like, no, but you have to. Why? Well, so they can see, you know what I mean? Just turn your head. Like, you know what I'm saying? But
Yeah.
it was with one thing that's, I think, interesting and such an important point, and something I hope will validate a lot of people potentially watching and listening to this. You're a healthcare provider, you're highly educated. You work daily in a hospital environment. This is not an intimidating place for you. It's not a place that you feel traumatized walking into. It's your work. You got friends who work at the hospital, like you are familiar. And you would expect somebody like yourself to have no problem whatsoever advocating for themselves. And yet, you, with all of your life experience and education, still found it challenging in that moment.
I did. I did. I think, and I don't know if other healthcare providers would feel the same too, but things are also different when you're the patient. I also work in an ICU where I see bad things happen all the time. And so I know the worst of the worst things that can happen. And when you have that in the back of your mind, I think it also makes you more fearful when you become the patient. Also, I have like a little bit of a control problem. So I have to relinquish a lot of my control when you move into a hospital setting, and you have to trust the people that you're putting your care into. And that was a choice that I made as far as having a hospital birth. And had I wanted to have a home birth, maybe that piece would be a little less anxiety provoking. But I also wanted to be in a hospital because I also worry that bad things can happen. So I wanted to be close. And that was a choice that I made. But I think, we knowing that bad things can happen and wanting in that moment too, you when you're giving birth, like it's hard to think about anything else other than like giving birth. And
Mhm.
so you're like conscious, it's like your subconscious is like aware of things that are around you. And I think that makes things also very difficult too, because even if I had played up all of these things about how I was going to advocate for myself in that moment, when you're giving birth, it's a lot harder. So I did have my husband on standby. So he was kind of was my support person. And I think it's still important to like have that person with you as well, because it's true. It's hard when you're in that moment. You are focused on the labor piece. So if other people around you are trying to like dictate and change your plans around you, it's harder to be like no or yes, like the lidocaine piece. I think I eventually was just like, sure, why not, fine.
Like, stop bothering me.
Yeah, exactly. I was literally just like, leave me alone, I'm in the zone, I'm in
Yeah,
the
yeah, yeah.
zone.
Yeah. I haven't heard that, to be honest, the lidocaine. That's interesting.
Yeah, so that was the older OB that came in, suggested that that yeah, everyone was like, I don't honestly know who she was, but my OB mentioned afterwards that she was like a legend on the
Oh.
floor. So I thought that was funny. Funny in multiple ways. But yeah, so I think, you know, again, to the people who are struggling to advocate for themselves, because I'm 100% in your shoes. Building your confidence and the education piece. You know, if you can, knowledge in some ways is power. If you have even just like this, things are obviously going to happen that you didn't know about or didn't plan for. But I think even knowing something and knowing pieces of things make you more confident in what's happening around you, so that you can make decisions and know what you want and what you don't want. And yeah, I do think having a support person next to you is really important, whoever that might be.
Yeah.
I didn't want a doula. I had, you know, faith in my husband to like do the thing. I did have my aunt wanted to be my doula for me, but I was like, no, I also like to keep things small. I didn't want a lot of people
Mhm.
around. I didn't invite a lot of family around or anything like that. I tried to just like, I was like in the zone, stay in the zone. Um, and that was important to me. So my husband was like, at first you told me you didn't want to hold my hand. Or he's like, you told me that you weren't sure if I wanted to hold your hand. And then all of a sudden you literally had my arm in like a death grip, and I wasn't allowed to let go, because at one point apparently I yelled at him like, don't let go. And he was like, I don't think I could if I wanted to, because I literally had like a death grip on him.
Yeah.
So yeah, I mean, I think also being open,
Yeah.
and knowing that things are going to happen regardless of whether you plan or you don't plan. Things always happen that are just kind of A, out of your control, or B, you didn't plan for or know about, or what have you. But it's gonna be okay, and you can make it work. Be open. Yeah, I really, yeah, the open piece is hard too, for sure. But
There's so
um,
much there. I mean, there's so much. I just, I think that you bring up so many good points. And I love also you had said that you didn't know you could feel this strong after birth, because you had
mm,
said after your cesarean birth, your recovery was challenging, as it typically is after major abdominal surgery. And you found that this recovery was very different. I'd love you to just, maybe we can finish up with chatting a little bit about that.
yeah, absolutely. I There are so many things different about my second birth than my first birth, so I can't necessarily speak to whether or not my strength afterwards was because I went unmedicated, or, I mean,
Mhm.
obviously an abdominal surgery is huge. But not only like physically did I feel different, I also emotionally and mentally felt different. I felt way more regulated after my second birth. I didn't go through like this really like empty feel. I had this like really empty feeling after my vaginal or after my C-section. And I I was like going through the motions. I feel
Mhm.
like every mom after they give birth has like this I don't know, a couple weeks of like super, super strength where like you can do everything because you're like literally not sleeping, but you're still doing all the things. And then eventually the no sleep catches up with you. But I, I really wanted to feel stronger after this second delivery, and having the vaginal birth was huge. And also like unexpected. I very much went in with, if things can't go the way I want them to, then it will be what it is. And we'll figure it out one way or the other. But yeah, after giving birth to my son, I was home with my toddler less than 24 hours after giving birth to him, taking care of my 2-year-old. And my husband was still working. So I was still very much in the throes of like waking up and doing the feedings. And because I'm still breastfeeding. And so I was like, I did have like some family members on standby, thank goodness, to help a little bit with that. But yeah, and my 2-year-old was still very much like a mommy, mommy, mommy. And as many of us know, after having the second, you can't stop momming. And the 2-year-old wants to be involved. Like they want to help. They, whether you want them to or not, they're going to help you. And it was empowering to be able to do all of those things and still be aware. I didn't have that emptiness that I had after my C-section, where I felt like I was going through the motions, but not like actually present sometimes. And obviously not having the abdominal surgery, just feel like so much, the strength that I had after giving birth is just, I was like, so this is why you should have a vaginal birth. Like, I know, like, we all know that a C-section is not the natural way to do things, but like if they happen often enough, plenty of moms get them. So I was just kind of like, it could also be the way that it has to go, right? And so maybe the vaginal birth will be different, obviously, but similar, right? The feelings and everything like that, but is not. I definitely felt after having the vaginal birth, I was like, wow, no, like my body is supposed to do this. Like my body is it can and does give birth. Like it can, do all of these things. Like, whereas after the C-section, I was like, I don't know if women's bodies are supposed to be doing all of this. I don't know, guys. But it is, it's empowering. I feel so much better. I'm stronger. I'm not having to do all of the core rehab that I had to do with the C-section. I got to labor on my side, so I'm not having this weird tailbone business. At least that's what I'm chalking it up to. Probably a lot of things, but it's just, it was amazing. It was amazing. I don't even know how to like really describe it sometimes, because I just felt so good. I felt so good. Amazing. So different. I was like, I don't know if everybody feels this way after giving birth, but I think the contrast in the two is just so different. And it was a wild ride.
I think the contrast, anyone I've ever spoken to who has had the lived experience of delivering their baby, both via cesarean and vaginally, has echoed what you just shared. Everybody.
Yeah.
And it's hard to speak on it if you haven't experienced both firsthand. So I really do appreciate you weighing in, because I've got a lot of friends who've only given birth via cesarean. That's all they know. And I only know vaginal birth myself in my own body. So I love the ability to talk with you. I mean, you've literally done it all, my friend. So lucky you, right? But it also allows you to offer perspective that I think is so important for people to hear. So thank you.